Live from ABC7, this is More in the Morning.
With the weather getting warmer, sun getting stronger, this is a good time to remind everyone that putting on sunscreen before stepping outside, always a good idea. May is Skin Cancer Awareness Month, and today I have Dr. Durando from Riverchase Dermatology here getting us more on the importance of prevention. Good morning, doctor. Thanks for coming.
Good morning. Thank you for having me.
Of course. So it's Skin Cancer Awareness Month.
Yes.
You were telling me that it's one of the most common cancers out there, but it is also one of the most preventable.
Yes, skin cancer is the most common skin cancer. I mean, it's the most common cancer diagnosis each year. It is definitely one of the most preventable skin cancer. When found early, it's highly curable.
So how do we go about preventing, keeping our skin healthy? We live in Southwest Florida. It's such a beautiful area. We always want to go outside and be out there. How can we make sure that we're preventing, skin cancer?
So the most important thing to do to prevent skin cancer is to protect yourself from the sun. So how do we do that? So you have to wear sunscreen. You have to seek shade. You want to avoid the hours between 10 and 2. You want to wear long sleeve, lightweight long sleeve shirts, hats, sunglasses that protect you from the sun. And the most important thing is you want to make sure that you're staying out of the sun as much as you can.
Absolutely. But you were also telling me about how you can do a self-exam. You can check yourself out if you are out there in the sun maybe for a little bit longer than you plan to be.
Yes, it's very important. The Skin Cancer Foundation recommend that we're doing self-exams to our skin once a month. One of the ways that you can do that is to stand yourself in front of your mirror, check your face, check your chest, your back, maybe even get a handheld mirror to check the hard-to-reach areas like the back of your neck, your buttocks, the back of the legs. And if you can reach some areas, then have your partner, your friends, your spouse to help you check your back. Take photos. I have my patients tell their spouses and friends to take photos of their back, and that way they can monitor their skin over time, and they can spot anything that's new or changing.
Now, there's different kinds of skin cancer as well. Is there anything specific that you should be checking for? Is it circular sores? Is it, redness?
Absolutely. The most common type of skin cancer is basal cell carcinoma, and that can present like a pink bump that bleeds easily. It's not healing. It bleeds. It's itchy. The other type of skin cancer, that's the second most common type of skin cancer, is squamous cell carcinoma, and that's going to be a crusty plaque, a scaly patch, or a non-healing sore on the skin. Sometimes that's very painful to the touch. And then the last and third most common type of skin cancer, and the one that we worry the most because it's the deadliest form of skin cancer, is malignant melanoma. Malignant melanoma can present as a new spot. It can also present within a mole that you already had. So it's important to check for changes. And one of the tools that we use to help us decide whether a mole or a lesion is concerning for melanoma is called the ABCDEs of melanoma. And that stands for asymmetry. A stands for asymmetry. So if you were to divide your mole in half, if half of the lesion is bigger than the other, that's definitely a concern. B stands for borders. You want your moles to be perfectly circular, sharp borders. If the borders become irregular or ragged, that's definitely a concern. C stands for color. So you want your moles to be uniform in color. You want one color throughout. If you start to see that your moles are changing color, becoming pink, blue, dark, black, that's definitely a concern. D stands for diameter. It's bigger than 6 millimeters, the size of a pencil eraser. And also, something else that can stand for D that we're trying to spread awareness is dark. Is your mole dark? If it's very dark, you should get it checked out. E for me is one of the most important clues. Is it evolving over time? Is it changing? I used to have a mole that's small, and now in the last few months, it's double in size. That's definitely a concern.
So if you see any of those changes, you want to go and see your physician right away.
See your dermatologist once a year. And if you have a family or a personal history of skin cancer, you might have to see them more than once a year.
All right, doctor, thank you so much for coming in. I really appreciate it. These are all really good tips and, advice for folks out there. Thank you again.
Thank you, Anissa. Thank you so much for having us.
Anytime, anytime.